The arrival of 1,020,000 doses of the Oxford AstraZeneca COVID-19 vaccine in the country and the subsequent vaccination drive has been termed as a game changer in the fight against the deadly COVID-19 disease. Government officials and development partners alike hoping that this marks a new dawn in the fight against the COVID-19 disease. The number of COVID-19 cases continues to increase, with over 110,000 infections reported since 13th March last year. Purity Museo explores the COVID-19 journey and where we are in the fight 1 year on.
The rolls of turbine engines on the Qatar Airways plane flight QR1341 disturbed the Nairobi night sky on Tuesday, the 2nd of March 2021. Minutes later, it landed at the Jomo Kenyatta International Airport. Its priceless cargo, some 1,020,000 doses of the Oxford AstraZeneca vaccine, Kenya's first batch of the jabs manufactured by the Serum Institute of India. Government officials and development partners terming the arrival of the vaccine a new dawn for Kenya in the fight against the deadly COVID-19 disease.
We've been fighting COVID-19. We've been fighting this virus, but we have been fighting it with rubber bullets. But this time round, what we have received here is equivalent, metaphorically speaking, to acquisition of machine guns, bazookas, and tanks to fight this war against COVID-19.
I must congratulate this team for this historic moment. In the Ministry of Transport, we would like to support the Ministry of Health in terms of transport and logistics.
President Uhuru Kenyatta would a day later flag the nationwide distribution of the available doses.
Tunataka kuhakikisha ya kwamba Wakenya wote wameweza kupata chanjo ambaye itawasaidia kuzuia huu ugonjwa wa COVID-19.
Frontline healthcare workers were the first to receive the jab. The vaccination exercise is currently underway across the country.
I'm feeling great. That is why I can be able to stand in front of you in this hot sun and address you. So that is an indication that the vaccine is safe.
Between January and March 2021, Kenya has witnessed what experts link to a third wave of the COVID-19 disease. The coronavirus positivity rate jumped from 2% in January to between 7 and 10% in March. Health officials have expressed concern, warning continued disregard of the COVID-19 protocols is frustrating efforts to the fight.
What we are saying is that even as the vaccine comes, we also know that the virus is spreading, and it is spreading at a faster rate than we have seen over the last 2 months. So it is important for us to stay vigilant and to be aware that vaccines do not come to cure. Vaccines have essentially come to give us immunity for those we are going to vaccinate.
Political campaigns, among other social gatherings, have resumed, a worrying trend that medics term the coronavirus super spreader events.
What we're having right now in terms of the increased political rallies, the increased gatherings, is actually a big threat to resurgence of the infection. Much a bigger threat than kids going back to school.
As Kenyans grapple with the fatigue of wearing face masks and adhering to other containment measures, experts say this may be the new normal, at least for another 1 year. Vaccination alone will not win the battle.
We have been very, very lucky, but we should be careful that things might actually get out of hand. We've seen it in other countries. They were under control, and all of a sudden, boom. And if that happens, I think it is critical that the government, the health authorities, remain vigilant, because the minute there is a sign of any new surge, the only way to go about will be to have a serious lockdown or serious restrictions of movement to limit the infectivity.
Despite the fact that the vaccine has arrived and will continue, because we will get more and more doses until we meet our requirement. That does not remove from every single citizen the obligation and the duty to continue to maintain the health protocols that we have been given by our doctors, by our experts.
As part of the new normal and in an effort to win the fight against the coronavirus in the country, the government directed public service vehicles to operate at half capacity to ensure social distancing among the passengers. School-going children must also put on a face mask to prevent the outbreak of the deadly disease in institutions of higher learning. The directive is still in force. Shortly after the outbreak of the disease in Wuhan City, China, late last year, only health workers were advised to put on a mask. But as the disease continually mutated, all people were advised to put on a mask, especially when distancing cannot be maintained, keeping rooms well ventilated, avoiding crowds and close contact, regularly cleaning your hands and coughing into a bent elbow or tissue. Maintain constant preventive measures for the COVID-19 disease. There is no known cure for the COVID-19, but scientists around the world are working to find and develop treatments for COVID-19. At least there are vaccines available to prevent one from getting complications in case of infection. Though scientists had warned the world of a possible pandemic, no one could have predicted the scale and impact of COVID-19. The fight continues. Purity Museo, Channel 1 News.